Deciding to buy a hearing aid is a major step, but how do you make sure you do it right the first time? With advice, I'm here with Dr. Danny Gnewikow here at Audiology Hearing Aid Associates, and it really is something you need to make sure that you do right the first time.
I think that's right. A hearing aid is a fairly expensive device, and you're going to be using it for 5 to 10 years, so you really want to investigate things a little before you do it. Things to look at the credentials of the provider. Audiologists are required to have a doctorate degree, which is several years of graduate training beyond the bachelor's degree. Look at how long the practice has been in the area. Mm-hmm. It doesn't mean that new practices can't help individuals. I'm sure they can, but a lot of times you see situations where people may get hearing aids from a particular locale, and then 2 years later, the people are no longer there. So people who have longevity, it's probably a better risk for people that have done that. Plus, the longer you do something, the better you get at it. Having surgery by someone who's never performed the surgery versus someone who's done it for 30 years, you would know which one you might prefer.
Right. Makes sense.
So I think longevity is important. In one of the previous sessions, we had talked about the protocols for fitting hearing aids. Be sure they use real ear probe measures, because that's kind of the gold standard of making sure the hearing aid is doing what it should be doing. And you can ask them, do you do probe measures? And if they don't, then you might want to look a little further. Be sure they give you a trial period. Now, granted, they don't give you that with glasses, but most audiologists will give you a trial period with hearing aids, so you can actually wear them for a few weeks in your home environment to make sure that you can adapt to them and be sure that they're meeting your needs. Some facilities will require you to pay for the hearing aid initially and then give you a few weeks to become acclimated to it, and if you're unable, then they will give you a significant portion of your money back. It's okay to do that to cover their time. In our particular facility, we don't charge anything. We allow the patients to wear the hearing aids for several weeks under our supervision without paying for them, to be sure that they get it for the right reason. So I think a trial period is important. Financial issues are also important. Although most insurance companies do not reimburse for hearing aids, more and more are beginning to. So be sure that the facility is willing to work with the insurance company and file your insurance for you. And then once you get the hearing aid, if you're not in a position where you can pay for it all at one time, which a lot of retirees are not, find out what their financing arrangements are. There are finance companies that do allow you to get the hearing aids over time, but there are interest charges. Many practices, including ours, allow you to pay for the hearing aids over an extended period of time with no interest charge. And again, every little bit helps, and even though interest is not a big deal, that's still money that you don't have. So I think the trial period under those circumstances is probably something to ask about. And then you need to look at reputation. And there's a couple ways you can do that. You can look on the internet, and a lot of websites will have comments from people. Or you can talk to people who have been to the facility. That's probably the best way to find out what their experience was. But don't ever forget that you are generally being cared for by your primary care physician, and he is looking out for your best interests. So ask your primary care physician, do you know of the best approach for me if I'm interested in considering getting a hearing aid? So I think if you do those things, I think you have a better shot at having a successful experience. Remember, this is a long-term investment. A little homework may not only save you money in the long run, but may result in a much better bottom line as far as improving your hearing is concerned.
And I wanted to have a chance to also talk about something very exciting. You are award-winning yet again. Let's talk about this. Top practice in the South Side and Lynchburg, and best bedside manner. And that's wonderful. This isn't the first time this has happened.
We've just got a good staff here, so that's not me, that's the staff that works for me. And I can't say enough about the team that we have here. They all work together, and we try to do what's in the best interest of the patient, and so I have to give them the kudos.
And you guys have been in this area for a long time, haven't you?
We have been in Lynchburg for 35 years maybe. We've been in Danville for like 44. So we are probably the oldest and largest private audiology facility in Virginia.
And to find out more about Audiology Hearing Aid Associates and their locations, there's one on Langhorne Road in Lynchburg. The number there is 434-528-4245. Their Danville location is on Main Street, and that number is 434-799-6288. And you can also find out more about audiologist Dr. Gnewikow and his team at digitalhearingforyou.com. And we'll be right back.